Hi, I'm Dr. Craig Castanet of Back Strong Clinic. I'm going to talk to you today about the treatment of degenerative disc disease. Degenerative disc disease is very common. What's more important, because it's largely a function of time and it is very often a normal part of the process, or such a common part of the process of aging, that it's hard to call abnormal. It's very common. The real question is, do you have a disproportionate or a non-age appropriate amount of degenerative changes? In any case, if it's a source of pain, let me show you what happens. I'm going to use a model right here. This first model is meant to demonstrate what a normal spine looks like. This would be the back of somebody's spine. This happens to be the low back bones here, but this could be the neck. The anatomy is similar. This is a disc between. The disc acts as a shock absorber in between the bones. What happens over time with degenerative disc disease is the disc here, the outer fibers tear, water content and mechanics and physiology and the disc changes so that it becomes more diseased. It becomes a bad environment for the cells that live in the disc. Those cells then start to die off. The cells that do remain are synthesizing or making fewer of the molecules that are necessary to repair the disc. So over time you end up with a dark looking disc on MRI scan. It becomes flatter, closer like to a pancake. If you look at it microscopically, it's not happy. It has fewer cells in it. And if you were to quantify histologically or microscopically the molecules that are being made by the cells, there are fewer in number. So it's a very unhappy disc, and those microscopic changes will give rise eventually to gross changes in the appearance of your disc on an MRI scan, and they'll make you unhappy also. They'll give rise to pain and disability. So what we see on an MRI scan often is a dark colored disc because it's lost the water content, which is usually white in color, at least on some of the MRI images. And you'll see it'll be flatter. That places more stress on the joints. The joints can then become enlarged and become another source of pain. And as the discs collapse, the holes on the sides where the nerves exit become smaller. That means your threshold for pinching the nerve becomes smaller or lower. And so there are a lot of potential sources of pain with a degenerated disc. The best way to treat degenerated discs non-surgically is to do what we term spinal decompression treatment, and that's something that is uncommon among physical therapy clinics. The way we treat this is we place people on a spinal decompression treatment table. We secure them to the table. This is generally a very comfortable process. That table then gently separates the vertebrae over the course of about half an hour. When you separate the vertebrae, you get pressure off the discs, joints, and nerves. That relieves the pain while you're on the table. It also gets more water, oxygen, and nutrients into the disc. That creates a better cellular environment for the disc. And that means that the cells then can divide, make more cells, and make more of the materials that repair the disc. So there is, in a microscopic but meaningfully and clinically meaningful way, make your disc better and improved. Generally, this treatment, we know empirically, makes people feel very much improved. Generally, it lasts for a good long time, meaning many months to several years. The reason I say that is because a question put to me by many patients and even professionals is that you put somebody on a table, it decompresses them, but don't they get compressed when they get upright again? The answer to that is yes and no. Grossly, we're not making a lot of changes on the table. Those are more microscopic. There are some gross changes. In fact, they've been measured as up to 7 millimeters distraction in one study. 7 millimeters is about a little more than 1/4 of an inch. So you get that sort of change, but microscopically it initiates important, meaningful, and clinically significant changes. The important thing is that we know from this treatment that and in my clinical experience I would corroborate this, it is the most effective clinical tool I've had for the treatment of neck and back pain. If I had to put something on the top, it would be spinal decompression. Physical therapy should include also other things to address disc degeneration, including core strengthening. That's a very common approach to the treatment of disc degeneration. But disc degeneration isn't changed and affected by core strengthening. Core strengthening is important for strengthening the core to protect insults to the back, so that during the course of your normal days, you're not further insulting the back and there are certain concepts about biomechanics and posture, etc., that are important also in the long term. But in terms of disc degeneration, you owe it to yourself, and us professionals should provide the opportunity to physically decompress that degenerated disc. We know what the mechanism of disc degeneration is, and it's progressive compression of the disc. And so decompressing that disc or reversing that process is a direct, rational, and should be a fundamental approach to the treatment of disc degeneration. We provide it at Backstrong, and we'd like to help you. Thanks.